For those who are new a little bit to this field, PHE is Population Health Environment. It's projects that integrate population, family planning, with other health interventions and conservation or other environmental and natural resource management interventions. And these projects grew out of the integrated conservation and development programs, which were implemented in the 80s or into the early 90s, which were really looking at integrated development and with a focus on bringing development to conservation areas. And one of the critiques of that approach was that it was broad. It was a little bit of everything but the kitchen sink. And so the population health environment field grew out of that in an interest to try to narrow down what you're integrating, which is really let's narrow it to health with a focus on family planning and conservation. And so actually the projects were called in the very early days POP environment programs. And some of us that were working on it were POP environment fellows. And this was really in response to kind of the everything but the kitchen sink to more of a, it's just population and environment. And those projects focused on delivering family planning services to communities that really wanted and needed them, that were in and around areas of high biodiversity, conservation priority areas. They were relatively small scale projects that were working at the very local level with communities. And they were driven by a sense of this is what communities are asking for. And one of our colleagues in that field, Bob Engelman, wrote a book called More, What Women Are Asking For and the Links Between Population and Environment, that really was a reflection on what we learned from that era. And a lot of those projects were driven by the conservation community and natural resources management community that saw a need for linking family planning into the interventions they were doing at the community level. Those programs evolved over the course of several years to recognize that communities not only wanted family planning, but they also wanted other health interventions, and that a lot of communities needed basic health services. And so the population environment field was broadened to population health and environment. And also, I would say on the environment side, broadened to include livelihoods. It wasn't just about conservation of species, conservation of protecting areas, but also looking at what is it about natural resources that people depend on and how do we protect that as well. And so there was an opening to looking at how do we help people, not just depend on natural resources, but try to diversify their incomes and the types of resources that they're trying to tap to make a livelihood. And so, again, these programs were relatively small still in scale, working along isolated communities around protected areas and other areas of high biodiversity. But also an interest in looking at what is it that we're really trying to achieve through these projects. Are we making an impact? Are we making an impact beyond just what normal conservation groups are doing or what health groups are doing? Or what is the benefit of integrating this? So looking at how do we measure the benefit of integration? And also at this time, and I think Roger Mark can speak more to this, there was a link to policy activities. So it's not just about delivering services to communities, but it's about then communicating why we're doing that to policymakers at the national level and at the international level. And then finally, there was a real effort to try to do some operations research on these projects and try to really measure those results. And I can speak later on about some of those efforts as well. So coming to now the present day, where are we growing out of that broader expansion to population health and environment? What I see is that we have still a relatively small number of projects that are scattered around sub-Saharan Africa, mostly East Africa, Madagascar, and Asia, mostly the Philippines, but have been in other parts of Southeast Asia in the past. And we're still looking at a relatively small scale of intervention. And so one of the things I see us really needing to move towards in the future is how do we show greater impact, or what we like to call in the development field scaling up. And so I think right now we're looking at projects that are trying to look at how do we have more impact. I also think what we're looking at right now is projects that are still struggling with how do we demonstrate impact, and how do we show what the benefit of this integration is, not just from the perspective of I'm a conservation group and I want to show this, or I'm a health group, but also from the greater kind of development perspective. How do we show the benefit to development as a whole in terms of integrating population health and environment? I also think that where we are now, there are several really good models for how you do this integrated development. And we've shown that they're good models, that they work, and that many organizations can actually take them up and start implementing them. And also we've learned that there are other models out there that are also really good, that are not called population health environment projects, but that are very similar and that we should also be looking at and trying to replicate and study and demonstrate the impact of. At the same time, there's really a desire now to take this approach outside of a small group of conservation groups and a few health groups who are implementing it to a much larger community. And so right now what we're really trying to do is get more champions on board who are implementing this approach and who can talk about why it's such a good approach. We're trying to get more donors interested in it. And we're also trying to get more organizations that are in the field to learn how to do it, because integration is complex, and so it's not something you can just pick up a manual and do. But you really need to have some hand-holding, some capacity building. And finally, I think we've come to the understanding that PHE and integration is not something that works everywhere. It's not something that you just can do in every place that you want to do development. But it really needs to be targeted at the right places. So for population health environment programs, I think that organizations have realized that you do this where there's some relationship between population demographic factors, so where population growth is high, where there is actually a stated need for these issues, for these for population and family planning services, for health services, and for conservation services, and in areas where if you were to address these factors in an integrated way, you would really see benefits that go beyond just the conservation and health benefits, but general development benefits. And so I think that recognition has taken some time to get to, but there is really a recognition that it's not an everything approach for everyone everywhere. So I think I'll leave it there. I have many other thoughts.